Good morning, everyone. On behalf of the Mount Washington Valley Economic Council, I want to greet you and welcome you. I think this is going to be an exceptionally informative presentation, and I know you'll be looking forward to it. We just got new technology in the college, and I'm not used to having this much sound, so we'll all adjust to the fact that hopefully everybody out back can hear us for the first time since we've been doing eggs here. Okay, on behalf of the council, I want to thank New Hampshire Electric Co-op for sponsoring Eggs and Issues, as they have been the last couple of years. Gail Payne is sitting here. She is one of the folks who helps us out. So can you all give her a round of applause, please? And also want to thank HEB Engineering. I'm struggling with that name, and as they go through their different iterations. New Hampshire Bank and TD Bank. Is that correct, Jack?
Bank of New Hampshire and Glen
Group, thank you. Okay, we don't have our banners up because we just got painted, so I usually have my prompts that are sitting there, and without them, I'm not quite so good. So without further ado, I'm going to have each of our speakers introduce themselves, and we will get started.
Thank you, Linda. My name is Alex Feldweb. I'm the Deputy Commissioner at the New Hampshire Insurance Department. And this morning, we're here to give you a preview, kind of a point-in-time snapshot of the networks that the carriers in New Hampshire will be offering on the New Hampshire marketplace, the federally operated marketplace. And the preview will focus on which hospitals are in the networks of the various issuers. And so what we're giving you today is very kind of high-level summary, and the full information will be available in November when the plans go up for sale, and everyone will have access to information about every single provider in the network at the website of each of the carriers. The big news that we want to convey and that we're excited about is that in the New Hampshire marketplace this year, we will have 5 issuers, which is represents a lot more choice than we had in year 1 when we had only 1 carrier in the marketplace. So that's a big difference that we didn't know that was going to happen, and so we're very happy that we have that, and we have quite a good choice. We have a couple of co-ops amongst the new issuers. What we're going to try to do is to give you an idea of what the networks look like for those 5 issuers. On kind of a high level. And so we're talking about the networks that are going to be offered through the marketplace, the federal marketplace, which is the forum that people go through to access the tax subsidy. There's also an insurance market outside of the marketplace where carriers will be offering coverage. But the information we'll be presenting today will be focused on the marketplace. And the other piece of good news is that if you're focused on your local hospital and having access to a doctor who has admitting privileges at your local hospital, you'll see in the presentation today that for each hospital in the state, there are at least 3 carriers who have contracts with that hospital. So no matter what hospital you prefer or what local doctor associated with that hospital, you'll have a choice of carriers and then an even greater choice of plan types. And we'll try to provide you with some summary information about that. We'll have time at the end for questions. Some of our answers will be, we don't know yet, because we're in the middle of going through the filings, but since there was such intense public interest in the networks last year, we wanted to provide this information at this early stage. And in fact, we supported legislation that would pass this session that provided that the insurance department would come out and give the information even before the plans are finally approved, which occurs in August at this stage, and an opportunity to comment. So at one of the last slides, we'll have the email address where if you have any comments on the networks, you can provide them through that email. We have cards somewhere, I think right here, with that email address on it too, if you don't want to copy it down from our slide presentation. Our slide presentation is available on our website as well. We didn't make copies today, but it's pretty easily available. So what I'd like to do now is ask Jenny Patterson, our Life Accident and Health Legal Counsel, to go through our presentation, give you the detail about the different networks that are going to be available for 2015.
Great. Thanks, Alex. Thanks to all of you for being here. Again, I'm Jennifer Patterson. I'm the Life Accident and Health Legal Counsel with the New Hampshire Insurance Department. And for those of you in the back, you may not be able to see these slides really well. As Alex said, they are posted already on our website. This is the second of these public information sessions that we've done, and so you can go to the Insurance Department website and look at those. And I think that in the materials in front of you, it includes the key slide, which kind of shows which hospitals are in which networks. So you can also look at that as well. And I believe there's information that was handed out to you that has how you can reach our website, if that's something that you're looking for. Okay. So what I'll do is just quickly go through, give a little bit of background on excuse me, the marketplace or exchange in New Hampshire and on the network adequacy review that the department conducts, and then move on to a preview of the networks. As Alex said, we're still at an early stage of reviewing these plans. We're trying to get the information out to the public while, it's right after we received it ourselves. So that review is ongoing, and this is really a small piece of that information, but I think a very important piece. So as probably most of you know, in New Hampshire, the marketplace or exchange is operated by the federal government. And it's really a private market model where consumers can go on, they choose from plans that are offered by private insurance carriers, and if they're income eligible, they can get a subsidy to help afford the coverage. So there's supposed to be this notion of competition between carriers and consumer choice, which is why we're so excited about all of the choices that are coming for 2015. We have a partnership, and what that partnership means is that the insurance department performs the plan management function, which is basically what the insurance department has always done with respect to insurance plans. So when a carrier wants to offer a policy, we read through all of the policy forms, we review and approve the rates, and then for these particular plans, we also look at the adequacy of the networks. But it's up to the carriers whether they want to come. We're glad that a number of them have now decided that they will. This slide, which I'm sure you can't see from the back, but this is the timeline for our review of the qualified health plans. And again, these are the plans that are offered on the marketplace. These plans won't be available for sale until November 15th, when open enrollment begins, and the coverage under these plans will start January 2015 or later. So, and this is always true for insurance plans, but there's a really long lead time for this review. So the way the process works for the marketplace plans is that between May 1st and June 15th, the carriers submitted all of the information to the department. So we've only just gotten all of the plan details. Then by early August, the department makes a recommendation to CSIO or CMS, which is the federal agency that's operating the marketplace, as to which of the plans actually meet the standard to be offered as what's known as QHPs or qualified health plans on the exchange. So during August and September, the federal agency reviews them, and then all of the details, including all the information about the benefits, all of the detailed provider information, and the rates become public at the latest on November 15th, which is when open enrollment starts. So for the rates, it's possible, or for even any of the plan details, it's possible that the carriers will choose to make that information available earlier, but it's really up to them whether to do so. All we know is that it will be available on November 15th. So part of the review that has to be conducted under the Affordable Care Act has to do with the adequacy of the networks that serve the people who purchase these plans. Now in New Hampshire, we have had a network adequacy statute and review for a long time. And you can see the language, or you may not be able to see the language because the print is probably small for those of you in the back. But under RSA 420J7, a health carrier is required to maintain a network that is sufficient in numbers, types, and geographic location of providers to ensure that all services to covered persons will be accessible without unreasonable delay. So again, the focus is on access to services, not to particular providers. And since it's a private market that this law is applied to, the idea is that consumers will pick the plan that works best for them. That could include the network and the providers. Okay. So for the marketplace plans, the review that we're conducting focuses on geographic accessibility. One of the differences between our network adequacy rules and the review that we're now conducting under the ACA is that typically we would look after the fact at how adequate were the networks to the people who were already enrolled in the plans. That's the way our statute and rules were set up. With the Affordable Care Act, there was this new requirement of review up front. And because looking at geographic accessibility was really what lent itself to that upfront review, that's what we have focused on. And again, just to keep in mind, there's lots of very detailed information that gets reviewed as part of this network adequacy review process, all of the providers and all of the different specialties and all of the services. What we're showing you today is the hospitals. So once November 15th rolls around, it will be really important for consumers to go onto the carriers' websites and look at those details of specific providers, PCPs and specialists. That will be available at that time. But what we're doing is just giving this basic overview with the hospitals right now. So Alex mentioned legislation. Senate Bill 340, which just passed this session, and I believe hasn't reached the governor's desk yet, is a law that the department supported. We thought it was a great idea to have more transparency around the network review that we conduct. So even though the law is not in effect yet, we are conducting the public information sessions. We are accepting public comment through July 8th, so please do submit comments if you have comments on the networks. And this presentation is being videotaped. I think it's going to be broadcast locally on TV, and it will also be available on our website and I think on some other websites as well. So we're really trying to get the information out there. We also plan, we mentioned that we've posted the slides. We'll be doing an updated version of the slides if there are changes to the networks that occur before August 1st. So do keep checking our website if you want to see updated versions. And even on the slides that we're presenting today, there are changes. What we need to do is wait until the carriers file all of the documentation with us. So there may be things that aren't sounding quite the same as what you've heard in press reports. That's because this is based on June 15th data and it will be updated. So all of these carriers are really still negotiating with the providers, and so that's why there may be changes to the networks. I think this slide says what I just said. So, Alex talked a little bit about the difference between what 2014 and what 2015 looked like. And this slide kind of graphically depicts that. So for 2014, we have one carrier. We have 14 plans, 11 on the individual marketplace and 3 on the shop or the small group marketplace. We have 16 hospitals that are included in Anthem's network. For 2015, we have 5 different carriers. We have Anthem, we have Assurant Health, Harvard Pilgrim, Maine Community Health, and Minuteman Health, who have all filed plans for us to review. So we're expecting, it says 50 plus, it's probably substantially more than 50. We have people who are working really hard. They worked really hard last year with 14 plans. So it's a lot of work reading through all of these forms and the plan details. So all of that has to be done by early August for us at the department. So, and the good news is that all 26 New Hampshire hospitals are included in at least one network, and actually all 26 are in, each hospital is in at least 3 networks, and that number may go up. So this slide just shows the different hospitals by county. But we can move on to the next slide, which is the one that you have on a handout. And so this lists every hospital in the state, and then on the map, the dot shows the number of hospitals that are, the number of plans that have contracted with that hospital. And then they are also listed. So if you want to look up a particular hospital, you can see how many plans have signed contracts with that hospital. And I'm not going through this in detail, but you can look on our website. We have an appendix that actually lists by plan the hospitals that are included. So all of that information, as up to date as we have it, is available on our website. Okay, so what I'm going to do next is go through carrier by carrier, and I think this is going to be too small for most of you to see, so let me just summarize the information. So this is Anthem's 2015 network. It's called the Pathway Network. It is offered in all 10 counties, and for 2015, it will include 17 hospitals. It's an HMO product, and Anthem, as they are this year, will be offering plans both in the individual and in the small group market. There are also 2 out-of-state hospitals, and let me just say a word on this slide and on some of the other slides on other carriers. We mention out-of-state hospitals. The ones we mention are those that were submitted for our review in terms of determining the adequacy of the network. So at our last presentation, we did get other questions about out-of-state hospitals. We don't necessarily know, or we're not necessarily being, presenting today information on other out-of-state hospitals. These are the ones that were submitted for us to consider as part of the adequacy of the network. So Anthem's networks do include Maine Medical Center as well as Leahy Hospital and Medical Center. Okay. So this slide shows the network for Assurant Health. Assurant is offering plans in New Hampshire now outside the marketplace, so some of you may be familiar with them. Their network includes 25 hospitals. The only one that's not included is Upper Connecticut Valley. It's an individual product, and it's a PPO, and they're not offering, I think they're the only carrier that's not offering small group plans, only individual plans. Okay. So Harvard Pilgrim has 2 networks. Elevate Health is a limited network. It is only being offered in the southern counties. This slide says it has 9 hospitals. Harvard has been saying that they have 12 hospitals. They just haven't submitted all the paperwork yet, so we will get that and update it eventually by August 1st. Their coverage will be in both individual and the small group market. It's an HMO. So in addition to the limited network Elevate Health, they're also offering 2 networks, New England HMO and New Hampshire Network, that are in all 10 counties and that do include all 26 hospitals. Okay, Maine Community Health. Maine Community Health is one of the 2 co-ops. They've been very successful in Maine this year. They are coming in using a phased approach to New Hampshire. So they're only in 4 counties. They do include all 26 New Hampshire hospitals, as well as Maine Medical Center. And we were going to check. I don't know. We were going to check, but I don't know the answer as to whether other Maine hospitals that are close by are included. So we can check on that one. I would just assume that they are, but I don't know. Yes.
I've been told by Maine Community Health Options that they do cover hospitals both in the Boston area and nationwide, that they have a network available in every state of a doctor you could go to.
So I don't know if people could hear that. I think you have a loud voice. They probably could, but there have been statements that Maine Community Health has made that they do have a nationwide network or have access to a nationwide network.
What is PPO?
I'm going to let Al Kuchar answer that question. Let me give you the mic, Al.
PPO is a product type. So a typical benefit design for PPO is you have a level of benefit, the highest level of benefits if you go to a network provider. And then you also have access to non-network provider, but usually at a much higher cost sharing and limited benefits. So the advantage there is that you can go to just about any licensed provider and you have some benefits. Does that answer your question? Yeah, thank you.
I'm almost through the slides, so let me just continue through them, and then I think we'll have time for lots of questions as well. And that's Al Kuchar. Al, what is your job title?
Health Reform Coordinator.
Health Reform Coordinator, who's... But Al has worked in the health insurance industry for years, so he is the man for product descriptions. Okay, so the last carrier is Minuteman Health, another co-op who's coming in from Massachusetts. They are planning to offer products in both the individual and the small group market, both HMO and point of service plans. And Al can take questions on what that means after, if people do have questions. Right now, they have 13 hospitals in their network. They are still in the process of negotiating with providers, so their hope and expectation is that that number will go up. But that's what they have filed with us for now. Okay, so now is the time for questions. I don't know, Alex, do you want to come up? No, you can answer the questions.
No, I do. I have a comment. What I think is significant about the choices that are available now is that there are both the limited network option and the broad network option that are available for consumers. And that's what I think is key, because there's a fair amount of research that was done on the first year nationwide of the operation of marketplaces, and this phenomenon that a lot of carriers all across the country came in with limited networks. And the primary goal was to offer a more affordable product. And the research, the sort of consumer research they had done showed that many consumers, in fact a majority, would give up like their local hospital, their local provider, if it could get them like a 25% savings in premium. And in fact, nationwide, the limited networks were on average offered a savings of about 25%, which is very significant. So now we have the ability for consumers who prefer, the important thing is their provider, to choose a broad network, or for consumers, the important thing is, getting every dollar off the premium level they can to choose the narrow network. So the important advantage is to have an option for both, because a sizable population, prefers to save the money, and a sizable population prefers to have the broad choice. So that's what we're happy about for this year. So questions? Ed. Ed gets precedence because he's the chair of the Commerce Committee, and which we work with all the time.
Thank you. Why? Why 1 last year and 5 this year? How did we succeed as in such an impressive way?
Okay. The truth is I don't know, but I'd love to speculate. So if I may. Okay, my speculation is that it was very hard at the beginning of all of this for carriers to ramp up and get products available to offer on the exchange, because it was very much a different way of doing business. The product had to be completely redesigned to meet standards like the essential health benefits. And only carriers that were pretty large and had the resources and also the commitment, like an Anthem that had a lot of covered lives in the state already, were able to step in. And that just having more time, it was a big factor. And the other element, I believe, that's been driving the increased competition is that a lot more people are covered. There's more of a market, especially with, just many people signed up in New Hampshire, 40,000, many of which had been not insured before, and many more signed up off the marketplace with carriers that, the Assurant signed up a huge number, some 20,000 or 40,000 we believe. So our individual market went from being 20,000 to now close to 100,000. So that, a lot more people have insurance now. So that creates interest in the part of the carriers. And then the third element is the federal funding, the loans that were available to create this new type of insurance carrier, the co-ops. Two of our choices now are federal co-ops. So, run by a board of directors, which must be, majority of them, actual policyholders, and they're nonprofit. So it's a very interesting organizational structure, and those are just new players that were brought into existence through the ACA, and that has had an effect because we have 2 co-ops now operating in New Hampshire. So that would be my explanation of how come 1 and now 5. Yes, the end there?
Hi, I'm Cindy White, I'm a state representative from Monmouth. Do you think expanding Medicaid to increase the pool by almost 50,000 people would have something to do with attracting insurance companies to wanting to come into the state? Because I think that's a
Yes, I do. That was the other thing I meant to mention, and I forgot because I sort of got lost in my chain of reasons. I meant to mention that. And the particular way that the New Hampshire legislature chose to expand Medicaid, which is through the commercial market. I think it's actually like 57,000 lives that we expect. That is a large number in New Hampshire. So they're coming online now, and as of 2016, in the commercial marketplace, we will have additional 57,000 folks getting their coverage through the New Hampshire marketplace. So that will make it more robust, and we expect the 2 Medicaid managed care organizations to make the transition into the commercial marketplace. So theoretically, we might have these 5 plus 2 more in 2016. I don't know if they'll all stay, but that too is a big factor. Yeah, right there in the reddish shirt, and then you next. Okay.
Do you know if any of these plans are going to offer any sort of health savings accounts?
question?
Yes, the question is whether any of the plans offer a health savings account HSA compatible coverage. And Aaron, you might know that, or Al.
The answer is yes.
Okay,
We don't know how many or the details yet.
yeah, okay.
I mean, I think that Anthem already offers at least 2 plans that include an HSA. We're still in the process of reviewing the actual benefit design, so we don't have the information about the 2015 plans. But since there are so many plans, my expectation would be that there will be some others in addition to Anthem's that are available.
Okay, yes.
My interest is in comparing networks in the individual market to networks in the group market.
Yeah.
And in the group market today, people are allowed to go to the Boston hospitals, for instance, Boston Children's, or this for specialty needs.
Right.
And in today's individual market with Anthem, they're not allowed to do that. And
Yep.
I know that Maine Community Health Options is going to offer that, and I'm wondering what you know about the other providers.
Al, do you know?
So we haven't done a drill down evaluation of the networks yet, but based on the type of products like a PPO, okay, we sure would expect that's a good possibility that access to hospitals and providers outside New Hampshire would be available for some of these carriers. So it's a little early for us to answer specifically that question, but we expect that to be the case.
I mean, and just on this slide on Harvard Pilgrim, Harvard is offering choices so people and I think businesses both can choose between a limited network and then 2 that are broader, one of which is a New England HMO. So just from the name, I would think that that would be a more of a regional network. But I don't know the facts for sure. Yeah.
My question is,
Thanks. My question is about Anthem specifically. I noticed that Littleton Regional Hospital is no longer on the network. And my concern is with the auto enrollment that is supposed to take place if people do not act. It's going to be automatically enrolled. And is there going to be any safeguards to help those people make sure that they understand that their hospital is no longer covered?
I mean, I guess I'm thinking, I don't,
They still negotiate.
well, first, I don't know that there is auto-enrollment. I don't know if Aaron knows that. When the open enrollment period opens in November, I think people will know there will and should be some consumer outreach, which I think Aaron will be speaking to later. And I think people will be aware, we hope, because I think it's important for consumers to realize that things do change and that anytime you're enrolling in coverage, you should look at the provider network. The information about the networks will be available online, and it's a great point. People shouldn't assume that it will necessarily be the same as it was the prior year. Did you, Margot, have something on auto-enrollment?
Yeah, just to add to that, if there is auto-enrollment, you will be required to get notices from your health insurance issuer letting you know that you do have a time period in which you would need to make a choice to change your current plan before auto-enrollment does occur.
Who's been, Joan? Yeah.
I just want to also mention that if you speak to a licensed producer, that's what they're there to help you with, is to make sure that you understand the coverages and the network that you're getting into. I had to put a plug in.
No, that's true. It's not just a plug. Yeah, if you speak to a licensed producer, that's their job, to be familiar with the networks and the nuances of the benefit packages, and to elicit the information from the consumer about their situation, their preferences, and make that match.
Producer means agent.
Yes, agent, broker. Okay, the green.
yeah, you described a little bit about the difference in the business structure between the co-op and the more traditional.
Yeah.
But from a consumer perspective, is there a difference? Would you have the same protections and the same, like, appeal rights and all that if your coverage is denied?
Right. All the laws are the same, all the appeal rights, all the requirements about the benefit structure. It's more sort of the overall mission of the entity and who they're answerable to. Okay. In the back there on the left?
Mark Ragg, Conway Daily Sun, we have 50 people on Anthem. So this is like the most basic question. All these new plans are available only through the marketplace? Or do we have to, are they available through our private carrier? And would we have to drop a private carrier and go to the marketplace to have access to all the programs you're talking about? And my second question is, are there going to be real differences between the plans? I know in the old days, like when we had Sigma, it basically was the same thing as Anthem.
Okay, a lot of questions embedded in that. So what we're talking about today in terms of the networks is only the plans that will be sold on the marketplace. As Alex said at the beginning of the presentation, there's still a private market for insurance outside the exchange. So people absolutely still can go and get coverage outside the exchange. There may be additional plans, I don't actually know, that have different networks or different benefit structure that aren't included in this presentation. But if you are enrolling as an individual in the individual market, a couple of things are true because of the ACA, independent of the marketplace. The first one is that you have to enroll during the open enrollment period. So that for 2015 plans will be between November 15th and February 15th. If you don't sign up for coverage during that period, you won't be able to enroll unless you have a special qualifying event like losing your coverage, adding a dependent, getting married, something like that. So what, I'm losing track. Right, there is a requirement that plans that are sold in the marketplace also be available for sale outside the marketplace. So if someone doesn't want to buy it through the marketplace, they don't have to do that. But the marketplace is the only place that people can get the federal subsidies or assistance to help them afford that coverage. So if that subsidy goes all the way up to 400% of federal poverty level, so if somebody is above that income level, doesn't want to use the marketplace, they could still get this plan if they wanted to.
What about small groups? Yeah.
So, that's right, that was well, I'll get to the small groups in a second. You had also asked about the differences in the benefit design. So for every plan in the individual and small group market, regardless of whether it's being sold on or off the exchange, it has to meet certain requirements, and that includes offering the 10 essential health benefits. So it has to include, a whole list, hospital services, maternity, pediatric, vision and dental, a whole list of things have to be included in all of those plans, regardless of whether they're on or off the marketplace. And then they're also all grouped by metal levels, which reflects what's called the actuarial value of the plan, basically the percentage of the service costs that on average are covered by the plan as opposed to being borne by the consumer. So for instance, for a silver plan, that's a 70% actuarial value, so on average, 70% of the cost of services is covered by the plan and 30% by the covered person. Now, it's up to the company how they want to construct the benefits in terms of that 30%. So it might be co-pays, deductibles, and that's where the differences in plan design come into play. And that's something, particularly this coming year with 5 carriers and lots of different plans, I think even with 11 plans that are all offered by Anthem, it was challenging, I think, for consumers to understand what are the differences in benefit design. It's going to be a lot more complicated with different networks as well as different plan designs, products. Yep. Do you have anything to add to that?
So Jenny mentioned that the benefits all have to meet the essential health benefits. So they're going to look a lot alike, but remember, even though the benefits are identical, it's very different way you access the benefits if you're an HMO versus a PPO versus a point of service. So for this coming year, we're going to have choices. So even though you have the same scope of services covered, it depends on the type of products you have, PPO versus HMO, for example. A very different way you can access care. So, do your homework, and you'll find the differences. Yeah.
You mentioned the silver plan. This current year for Anthem, for the silver plan, I'm wondering if you can elaborate on why it was better subsidized, or, you know, because if you picked the gold plan, you had much higher costs, you had much higher deductibles, you had much higher copay. There was money coming out of some pocket to subsidize the silver. So I wonder if you could touch on
Yes,
that
I'd be happy to. That's a great question.
this year, and what's going to happen,
Yep.
will that happen for other carriers for next year?
Yes, great question. So the question was, this year for the silver plans, there's actually multiple silver plans that Anthem is offering. Why is it that the costs out of pocket may be much less for a silver plan than even a gold plan? And, you know, why? How does that work? It has to do with the way the Affordable Care Act offers assistance for people to afford health care. So there's actually two different kinds of assistance that are offered. The first one is what's called the Advanced Premium Tax Credit. It's money that goes to paying your premium, what you pay every month in order to be covered by the plan. But there's a second type of assistance called cost-sharing assistance. It's available to people who are making up to 250% of the federal poverty level, and that is only available if you buy a silver plan. So if someone without that assistance bought the silver plan, they would be paying on average 20% of the cost of services. But if they qualify for that additional subsidy, they actually get a different card. So they're getting a different copay, and what they pay out of pocket would be much less, but it's because it's subsidized through the federal government as part of the cost-sharing assistance. It's not a feature of the plan. So again, that will be true for all of the carriers that are offering plans, and for any plan that someone buys through the marketplace. As long as they're eligible by income for that cost-sharing assistance, they may end up with a much lower out-of-pocket, but it's because of that subsidy.
Can you tell us what 250% of the poverty level is, so we can understand?
I think there may be the best way to, I think on Covering New Hampshire, and again, Aaron's going to speak to this possibly, I don't know. But there's a website called Covering New Hampshire that is intended for consumers in New Hampshire to get information about the marketplace, and I believe there may be a chart. Yes. I don't know if you can read that from the back. Okay, so for a family of two, 250% of the federal poverty level, it looks like is $38,775. So it'll be slight, but those are last year's numbers, or these are 2014, not 2015, so it'd probably be slightly higher.
The reason I'm asking is because I work in HR, and I'm wondering if this new healthcare marketplace is going to create a shortage of people working because they can retire early and get healthcare, which is why a lot of people work. And will it be based on what their Social Security is, or where does that come from? Is it on their taxes? Is it their net worth? Help me understand that.
Yeah. Well, first, these subsidies are only available to people who are under 65. Once they're 65 and eligible for Medicare, they're not eligible for these subsidies. So, right. So in that age category, the first thing is, I mean, again, I can't speculate on what the dynamics are in the market and what people will choose to do. But if they are working and their employer offers coverage that's affordable to them, they are not eligible for this subsidy. So the first question that gets asked when someone goes on to apply for the subsidy is, do you have access to employer-sponsored coverage?
And if they quit,
Right.
say, I'm leaving, they have none. So let's say they're not working, but they were working, now they decide they're going to quit.
Right. And again, this is all administered by the federal government, not by the insurance department. So it's up to the IRS, I guess, is my answer. It's based on income. I don't think there's an asset test, but that's not something that we at the insurance department are involved with.
It's going to be, that is something
Yep.
that, I mean, people are not going to do.
Right. It's part of their taxes. That's why it's called an advanced premium tax credit. So you may have seen press coverage recently that the IRS is looking at discrepancies between what some people reported when they applied. So it all gets trued up at tax time. So if someone goes on and they want to apply for that tax credit based on their estimated income, they have to make a choice about, they have to pay it back if their income is higher once they pay their taxes for that year. Yes?
If you're traveling out of state or you have a second home someplace else, are you going to be limited to maybe a main community health program that might have nationwide coverage? I mean, people travel all the time. How do you handle that?
So the question is, if you have a second home or vacation, until we have more information on what the networks are, it's hard to answer that question. But so some of these carriers we know have nationwide network. Other carriers do not bring a nationwide network for this product. So if it's an HMO, it's probably more limited than if it's a PPO. But we haven't drilled down in the submissions to that level yet that we can answer that question.
For example, I know Anthem offers a nationwide program where they want $18,000 a year coverage for out in the marketplace.
You said that Anthem offered, that's not on the marketplace. Their marketplace product, right. So their marketplace product for 2014 is an HMO, and it's limited to, generally speaking, the providers in New Hampshire.
The ACA requires that urgent care and emergency room care be offered anywhere in the United States to anybody.
That's a good point. So even if you have an HMO, if it's an emergency, you are covered anywhere in the country.
Can you tell us why the platinum's not available?
The question was, why is there not a platinum plan in New Hampshire? And the answer is, again, this is a private market model. So it's up to the carriers what they want to offer. Anthem didn't choose to offer a platinum plan. I don't know the answer to that.
Yes.
We do? Okay.
It would be something.
Okay. Yep. Are we supposed to be wrapping it up? We also have Aaron Holman. Aaron is working with New Hampshire Health Plan, who's doing the outreach. That's not something that the insurance department is doing, and he's going to make a separate presentation. Okay. Is there another urgent question for the insurance department, just quickly? Yes.
It's kind of a general question, but you may not be able to answer it. The Affordable Care Act went into place last year, and I offer health insurance through a private market. And my rates went up like 35% this year, which seems not very affordable. I just don't know if there's any general response, reason why it should increase to such a drastic amount.
Was it individual market or small group? Okay. Well, the rating rules for the small group market changed somewhat in 2014. And whenever that happens, you have groups going down and groups going up. And we actually commissioned an economic model of what would happen, and we saw that in the model. To us, it seemed like relatively modest kind of rate shock for different groups when you change the rating rules for a small group. That is, the largest swing was in the range that you're talking about, that your group experienced. One of the factors that showed up as our model as influencing the rates was that, no, I'm sorry, I was going to say the high-risk pool, but that's the individual market. So it primarily the change in the rating rules.
Industry factors, we lost that.
Like what?
So it could be favorable industry factors, we no longer use industry.
Oh yeah, like the type of employer, and the group size. Smaller groups prior would get it rated up because it's less efficient to write coverage for groups of 3 or 4 or 5. And that went away. So that effect got blended across the whole market. So there were those changes that you know, experience in year one that will not exist as you go on. Sure.
So in some cases, I may have employees who find it more cost effective to go into the individual market and get coverage. I want to still be able to contribute, you know, subsidize their insurance costs as I've been doing. Is there a mechanism for me to do that as an employer?
Yes, you can do that. And we've talked to other small employers. We have an advisory board on the exchange, the marketplace that we meet with regularly. And one of the small employers there talked about how for her employees, she produced a stipend for them to go and get coverage in the individual market. The only issue with that is that it's after tax. And the question we've been pondering is whether, you know, in 2018, states can apply for waivers of almost any aspect of how the ACA works. Whether perhaps, you know, as a part of a waiver, small employers could still help their employees get coverage on a pre-tax basis and still have them access the coverage through the individual marketplace. That's, I think, in my mind, an open question. But that's the way it is now. You can offer a stipend, but it's after tax.
A comment on that, if you did that, that would be huge, because that would help decouple health insurance from employers and give employees more freedom to do what they want. And I think that's one of the big stumbling blocks for that stipend tax.
That's right. You know, this issue of employee choice of plans, I mean, the way it works now for small employers, primarily the employer chooses the carrier and then the employees sign up. And we know that there's a lot of desire for employee choice. You know, one of the ways to do that is to do this decoupling. You know, another way is, and eventually the shop, which is the exchange for small employers, will be able to offer employee choice, even though, you know, even through employer-sponsored coverage.
Comparative savings versus paying the tax portion of the income versus the savings between individual and group market is significantly different. And the tax stipend is a small piece of it.
Yeah, so in your wing, you know, the benefits, the tax advantage of, you know, pre-tax for the employer subsidy compared to the actual tax subsidy and cost-sharing protections available in the individual market seem much bigger, right?
It's not even close.
Yeah, yeah.
Okay, we're going to transition now.
Okay. But good discussion.
Lots of issues.
Thanks, Alex. So I'm going to do a quick kind of overview of the stuff we've been working on. My name's Aaron Holman. I'm working with the New Hampshire Health Plan, which is actually the state's high-risk pool, but is the sort of overseer or director of the Covering New Hampshire program, which is the sort of other half of some of the federal funds that have come in to help operate the marketplace. So the insurance department runs the marketplace, makes sure that it's certified. Oh, sorry, they don't run the marketplace. They run the certification and provide recommendations to the federal government. We are running an outreach and education campaign across the state to enroll folks and to provide information that consumers need in order to engage in the marketplace. So I wanted to just give a quick overview of what exactly we do and how we structured the program. And it's kind of a twofold piece. We have what we call a Marketplace Assister Program, which is a number of individuals that we have stationed across the state, all 10 counties. And we're using a lot of folks that we're already working in different areas of the state, assisting folks that with questions about health coverage and with actually providing health services. And we've got, so throughout the open enrollment period, we had around 40 folks across the state. We actually did a big sort of assessment leading into this exercise where we tried to figure out what the current number of uninsured was in the state, and then we went through and sort of built out a model to estimate if there were this many folks and we think it takes this long to sort of have a conversation with somebody to give out the educational materials that we have, how many folks are we going to actually need to sort of fill in the gaps and provide that resource of educational assistance. So we did a whole survey of everybody who is already doing this type of work in the state and came up with this around about 40 full-time equivalents, and the actual head count of that is actually much higher. But and then the other half of the program is we have an outreach and education campaign, which is essentially a statewide media campaign that includes a lot of, we did some television ads, we did some radio ads, we have a website, coveringnewhampshire.org, and we did a lot of sort of direct mail, and I'll get into some of the technical specifics of that. So that's overall kind of how we structured the program, and you can see some of the key statistics of what we were able to accomplish. We held over 5,200 one-on-one meetings, so a lot of our Marketplace Sisters were set up in different areas of the state. We've got a map on our website that allows you to find who those folks are in your area. You can call them, set up a one-on-one appointment, sit down, talk through any questions you had. We realized throughout the program that was a huge asset to folks. We ended up doing a lot of kind of office hours in different locations, public libraries, different areas around the state where folks could go on a pretty regular basis and sit down with somebody and talk through that. So that was a huge assistance. We also did 250 kind of town hall outreach meetings, stuff like that across the state. And pretty much throughout the entire open enrollment period of October 1 through the end of March, we did over about 10 events a day at any given time. Some of the kind of vital statistics of the outreach education campaign, our website, we launched it December 24th. We had some issues working alongside the federal government when it was shut down for a while in October, so it took us a little while to actually get the funds and get up and running. We sent out over 500,000 pieces of direct mail to folks, and I can explain kind of how we did that. And then we also did sort of a typical mass media approach. So real quick, this is just to say that there's a bunch of folks in the state who are doing this sort of application enrollment assistance. We run one program, and at the beginning of this project, we figured we needed this 37.5. It kind of went up and down from there, but there are federal navigators, which are folks that have a very similar reason, or they have a similar kind of drive of educating and assisting consumers. And they're funded directly by the federal government. There's also folks known as certified application counselors, and in our initial survey we found there's about 25 of them. That number ballooned throughout the open enrollment period. And then we also have a number of sort of other volunteers that we took into account. So when we figured out our deployment model of where to put people, we were trying to fit them into holes of where these other folks weren't already doing stuff. So our program was really designed to really complement the stuff that was ongoing already in the state. And so all our folks kind of went through a number of different levels of training. We had kind of bilingual folks. We did a lot of professional development throughout, because obviously this is a pretty technical topic. Most of our in-person sisters were pretty familiar with the products that were on the exchange, but we did a lot of kind of like technical assistance training. We actually got a really helpful briefing from Anthem to help with some of the specific. Yeah, sorry. They're not brokers, if that's the question. No, so we have a very strict line of the sort of level of educational material we can give out. Marketplace Sisters are there to provide information, education. We don't talk specifically about one plan over another. Our kind of wall that we run into is we can explain how the tax credits work. We can explain how some of the cost sharing reductions work that Jenny mentioned. And we can kind of walk through the technical aspects of signing up and help folks figure out technical issues that they're experiencing with healthcare.gov, that kind of stuff. So that's the line. But when folks want specific product level information, should I get this plan over that plan? We don't give that kind of advice. We refer to a broker, or most of the time we'll send the consumer to a website of all the kind of licensed brokers in the state. So then on the kind of outreach and education, this is kind of a horrific slide, but essentially this is just to show the main things we do. We had a website, coveringnewhampshire.org. We launched it December 24th. Again, we had some trouble kind of starting up at the beginning, getting the funds into the state. We did a large broadcast media campaign, so we had a lot of PSAs running. We also had a large radio advertising campaign. We did a very small network television buy, primarily because airspace is very expensive in the state. And we honestly did a small TV buy just because we got more media out of the fact that we ran a commercial than what the commercial actually did for us. So it's like an earned media buy, essentially. So we did a lot of very targeted cable buys, though, because you can target a cable ad to a block down to basically like a section of a city now. You don't have to buy an entire market. So that was actually a really helpful piece for us. And the good part is now, the good and scary part is that it's really easy to get a lot of commercially, publicly available data to build basically a huge model on who are the likely uninsured and kind of how do you reach out to them. So all of these things were intertwined. So the targeted cable buys we did were in areas that we knew had high concentrations of uninsured folks. We also were able to match those neighborhoods and those cities, blocks, houses to a direct mail campaign that we did where we sent out over 500,000 pieces of direct mail. We also could blend that with our actual in-person assisters, so when folks came in to ask questions, we have very strict regulations on like the information we can collect from folks, but if somebody says, I need someone to call me, we can actually call them. We did a huge amount of small business outreach, so we conducted a number of small business roundtables around the state. We also visited 9,500 different businesses. We sent out kind of small business test kits, or small business kits, which are break room posters, pay stub inserts about the marketplace, information around the tax structure, that kind of stuff. And we did just an absolute ton of research and polling, and I'll get into the kind of specifics around that. So the very first thing we did was build this huge model. So through we basically used the Civis file, which is a publicly available commercial data file you can get, where we ran we built a model that said, given these kind of 30 characteristics, who are the folks that we think are uninsured, and how are we going to kind of contact them? And so the very first thing we did was create this huge model to figure out, it's a little hard to see, but what's the spread of the actual folks in the state that are uninsured. And so everything we did was based off that model. And we had what we thought was about a 60 to 70% accuracy rate of being right, basically. So all the data would say this person's probably uninsured. We believe that's about 60 to 70%. It's very similar to how like a campaign does work, and that our rate was actually a little bit higher than what we had experienced. So what did we kind of find out in this initial research about the uninsured in the state? Half of the uninsured are under 40. In terms of education levels, 77% non-college folks. Heavy split, pretty even split between the North and the South. We actually ended up signing up more people in the North than we did in the South, which we thought was interesting. And important things around communications, majority of them are cell phone only users. Majority of them are either part-time in one job or in multiple jobs. They don't sit in front of a computer all day. They're all heavy Facebook and social media users, the majority of them. And so that gave us a lot of insight into how to communicate. So we did a lot of kind of digital advertising, which what we call is like cookie matching. So those like scary cookies everyone's always like, the NSA is using to spy on you. We can say with pretty good accuracy, this is what our model is saying for who this uninsured person is. We can also, when they log on to Facebook, have a Covering New Hampshire ad pop up on their opening thing. So you can work with Facebook, Google, Twitter, all those kind of organizations to do that very specific digital advertising. And so we did a lot more in that than we did any of the kind of broad media, just because we figured out all these characteristics about the uninsured. A lot of other stuff, we found, 70% of them either shop at Walmart, Market Basket, or Hannaford. We did a huge outreach campaign with those retail outlets. Majority of them are unmarried, majority are men, that kind of stuff. So then we kind of figured out who everyone was, or had a pretty good sense of who they were, and then we had to figure out, what do we say, what do people actually want to hear, and what do they listen to, what do they react to. So we did a round of focus groups, and we did a huge phone survey. And sorry, the formatting got a little messed up, but basically everything we said, everything we found, all the research we did pointed to people were concerned with affordability. And this is maybe a little confusing, but basically the questions were around, do you think things are priced fairly? We put example prices in front of folks, and basically in all the focus groups we did and all the polling that came back, we found heavy differences between men and women in terms of how they consider things affordable. Basically, we found that the typical woman that we had in our focus group thought that $100 a month was the kind of cutoff for affordability for an insurance plan. We found men were closer to $50. We found women reacted differently to messaging, obviously, very differently. Questions around affordability were obviously huge, but messages around security, avoiding the kind of catastrophic debt that can result from being an uninsured person who suffers a medical emergency. We got much more traction with female audiences. Males reacted to the penalty, the fee, the tax that's included. They reacted to deadlines. Females didn't really want to hear about deadlines. So the messaging became very different. So that also drove our campaign to do things differently. So the message we had in one piece of direct mail, we would push it towards a female audience. The message in another piece of mail that we sent out would go towards male audiences, that kind of thing. The kind of big message that we came away with after all this was, if you make less, you pay less, and a basic plan can cost as little as $50 a month. That was the kind of happy median we found. That's actually not totally true. Plans can be much cheaper than that if you qualify for higher advanced premium tax credits, but in the focus groups, we put some plans in front of people and we said, this plan can be as low as $12 a month, and people just shut off. They were like, that can't be true. This thing's not good. It's bad. So we realized we had to kind of bump it up. So the big takeaway was, on every piece of mail, all over the website, everything was this table. Because when we did the initial focus groups, the level of knowledge folks had on the ACA, it's highly influenced. The folks that we got in the focus group, we tried to find kind of a middle-of-the-road individual. All of them were uninsured. We thought they fell inside the income ranges. And folks were very shut off as we were going through, talking through different aspects of the ACA, blah, 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 getting super mixed messages from people. And then we put this chart in front of them, and everyone just kind of like leaned forward and started looking at it and was like, oh, yeah, I get it now. This is like, we're not talking about percentages of FPL. It's not cut up in a million different ways. It's just saying, if you file with this many people on your tax return, and you've got an income here, you might be eligible for an advanced premium tax credit. Yeah. Yeah, we're definitely not in the business of discouraging marriage. But yeah, I mean, obviously the size of your plan that you purchase is a huge determinant. Yeah. Well, again, this is, like Jenny said, there's a lot of kind of commercially driven activity in this marketplace because it's a commercial model, so those kind of rules still apply. Yeah.
On your thing, your intro there, like let's take for a family of two,
bottom, the 62, I think it is 640, what's the top number mean? So 15,510.
That's the low.
Is that,
That's 100% of federal poverty.
oh, so that's 100% of, okay, all right, okay.
It's just a whole range.
It's a
Okay,
whole
could you
range, yeah.
repeat the question too?
Yeah.
Oh, sorry, the question was just kind of how we built these brackets, these increments. And, you know, the advanced premium tax credits are only available for folks between 100 and 400%. So those are the two endpoints of that interval.
And is that chart available on the Covering New Hampshire website?
Yeah, yeah, and we did you know, every person that went through the site, we were able to see kind of what they clicked on, where they went to, and this chart was it's on the Do I Qualify page, and it was the most heavily visited piece of the site.
Do those numbers correlate to a number that is on your tax return? Like, I remember looking at it last year, and it was a little bit different than your adjustable income, but it wasn't line whatever, and it wasn't line whatever, you had to do
Right.
calculations.
No, yeah. Unfortunately, it's not like box 2H
Yeah.
or whatever. No.
Yeah,
It's the rules, and this isn't my place to speak, but the rules of calculating income were changed as a result of the ACA, and it's actually, in my opinion, very simplified. It's uniform now across all states, and so it's actually a modified adjusted income calculation that takes into account lots of different things to get to that final kind of gross income number. But
It's also an estimate.
it's also an estimate, so when you, right, exactly. So when you go on, you put in your yearly income estimate, and then, like Jenny said, it all gets trued up at tax time, and that's how you figure out.
exactly.
So after that, we kind of got the messaging down, we knew who we were talking to, then we had to figure out how we actually communicate. So, you know, real quick, we had, again, the website, we did a lot of digital advertising. As we went through, we realized people were responding to that a lot more. Again, we did the huge direct mail. We had a field team that helped our marketplace assisters kind of crowd build. So if one of the marketplace assisters said, I'm going to do an event at the library in such and such town, we could start to call folks on that list to say, hey, there's an event coming up, you know, Wednesday, 3 to 5 p.m. if you want to stop by, da-da-da. That was a huge assistance. We started to get a lot more folks to our events that way. Again, we did a tremendous amount of small business outreach where we went to over 99,000 businesses, physically went there, tried to find the person who was responsible for kind of making those decisions, dropped off information, got follow-up information, that sort of stuff. And then we worked a lot with, like I said, the folks in the state that were already doing work. So here's an example of some of the stuff we sent out. This is the break room poster that we sent to those businesses. A pay stub insert that employers could put in with pay stubs, and then we had some other information on SHOP. This is mostly kind of small employer stuff. So this is just to show you that, you know, obviously huge problems with healthcare.gov at the get-go. One of the real kind of benefits to our campaign was that because we got started a little late, we missed a lot of that. So we weren't shouting from the rooftops, go to healthcare.gov when it wasn't working. So we found out in the wrap-up survey that we did that that helped. People didn't actually experience a ton of catastrophic issues. Of the big poll, and we're releasing this in a week or two, that we did following open enrollment, we asked, same thing, 800 people, how was your experience? Did you have issues? And the vast majority of folks said, no, I really didn't have any huge issues. So that was a huge benefit to us, but you can see, you know, the website went up right around here, kind of bounced around, and then when we started doing digital ads, this is traffic per day, it started to bounce. And then when we hit direct mail, when they started hitting mailboxes, we had a huge bounce. We did a few TV ads, and it just kind of went up from there. So it was good because we were able to capitalize on a lot of the just general chatter that was going on, but also we kind of validated our model that as we did things, web traffic and registrations continue to go up. And so in the end, how did we do? Alex alluded to this earlier, but very well. The federal government anticipated that New Hampshire would insure 19,000 people through the market. At the end of March 31st, we were at 40,000. That number continues to go up, but again, the federal government runs the marketplace, so we don't have access to that information. And I put this little chart together because I use it in every presentation, because these are all the states that use healthcare.gov. So of all the states, if the baseline is federal expectation, so this is 19,000, this is how each state performed above or below as a percentage of that expectation. And you can see New Hampshire's #1. So of every single state that used healthcare.gov, New Hampshire performed above the federal expectations to the highest percentage of any state. And it was funny because every time we got the numbers every month, we get them from the federal government, they send out a report that says, okay, this month, this many people signed up. We were trading on and off with Maine, and we were like within a percentage the entire time. And then in the final number, when it came at the end of March, we actually ended up on top. So we took that as a huge kind of vindication. So this is my last slide. Basically, what are we doing now? Our funding runs through the end of the next open enrollment period, so we'll be here until mid-February of next year. And it's not open enrollment anymore, so folks can't just go and buy any plan they want on healthcare.gov, but there are still opportunities to do that if folks experience one of these kind of qualifying events like Jenny alluded to. Basically any change of tax status, job loss, adding a dependent, getting married, getting divorced, that kind of thing. Can allow you to go on and buy a plan as if it was open enrollment. So we're still focusing on that, but the big thing we're doing is we did a bunch of wrap up kind of what worked, what didn't work stuff in April and May, and now we're focusing on, we put together a list of kind of every not-for-profit, every advocacy group, every for-profit thing in the state that we thought would want more information about the marketplace. And we're kind of systematically using our Marketplace Assisters to work through that list and figure out, do they want more information? Are they willing to do something with us during open enrollment next year? Can we leave information at their front desk? All that kind of stuff. So we're building kind of this huge infrastructure that we can kind of turn on right before open enrollment next year and say, okay, we've got, you know, I don't know how big the list is, but it's like 15,000 different names of organizations and peoples and people and associations that we can say, we've talked to all these people over the summer, you know, 60% of them say, yeah, drop some brochures off in October, we're willing to do an event with you in November, and we can kind of switch that on when open enrollment starts so that our reach penetrates to a different level, because we're not always the best voice to communicate to folks. It's better if someone they know, someone they work with can say that message for us. So we're kind of building that infrastructure. We're also doing a ton of, we call it small business outreach. We're actually just doing a huge survey of what do small businesses in New Hampshire think about the ACA, what questions do they have, what are their perceptions, did they participate or not, and why. And our plan is that in the fall, we're going to start fielding that survey in the next week or two. And when we get the results back, in the fall, we're going to work with the state chambers, all the different chambers, Rotary clubs, New Hampshire Business Review, and probably some of the issuers to host a couple regional sort of business summits to talk about that, to say like, here's where the business community is at in terms of what they need to know, what they like, what they don't like. We're also targeting folks who are experiencing those qualifying events. So we're working with New Hampshire Employment Security or Department of New Hampshire Employment Security, and account folks, HR folks. We're always trying to get in contact with those individuals to try to find who are the folks that are having those changes in tax status, so we can say, hey, if you have questions about getting insurance, you know, you have 30 days now to do that. You know, get in touch with us, talk to one of our Marketplace Assisters, go to coveringnewhampshire.org. We're also doing a lot of coverage to care messaging. So we have 40,000 folks, many of which have never had insurance before or are getting insurance for the first time after a long time being uninsured. And we're trying to talk about the importance of preventative care, the importance of getting immunizations, kind of catching up on all that stuff that can really save you down the line. And so there's a lot of work around that kind of outreach. And those are the sort of, you know, 4 big things. And then all of this is working up to when open enrollment starts again in mid-November of next year, and we'll have kind of this infrastructure laid out and be ready to kind of do it all over again. So that's all I had. I don't know if we had any questions on that, or if there's other questions for the insurance department as well. But
Thank you. Okay, I want to thank all of you for coming. I'm sure that if you want to approach one-on-one and ask a couple questions, that would be quite possible. Our next Eggs and Issues will be August 14th. It will be a debate among the Republican candidates for the nomination for Senate to run against Senator Jeanne Shaheen, and the location will be announced as soon as we confirm our reservation. So thank you again for coming.
Local Focus, Channel 3, Community TV, Valley Vision, Local Focus, Valley Vision, Local Focus, Valley Vision, Local Focus, Valley Vision.